Welcome back to Mountain Connections. Right now we are going to focus on health and safety. We've been home more, but unfortunately that has caused more issues with kids ingesting things they shouldn't, especially those lithium coin batteries. They're small, they're circular, they look almost like candy, and of course it's awful if kids ingest them. So Duracell is working with doctors to hopefully prevent this from happening. What can you do to keep your home safe? Let's take a look.
With more people home in 2021, it's essential to child-proof our homes. Here with the scoop on how to help keep our families safe is pediatrician Dr. Ben Hoffman of the American Academy of Pediatrics. Good morning, Dr. Hoffman. Thanks for being here on Park City Television.
Good morning. It's a pleasure to be here. Thanks for the opportunity.
So tell us more about what is happening and how we need to help keep our families safe.
Yeah, so not that this is going to come as a surprise to anybody, but we're stuck at home a lot more. And part of what that means for kids is they're around the hazards that exist at home many more hours in the day than before. We know that parents and caregivers are really good at providing supervision for kids, but they can't be perfect. As a pediatrician, I know that kids are built to explore the environment, especially younger kids. And those kids are very likely, if they find things, to put things in their mouths. One of the unfortunate consequences of the pandemic is we've seen a significant increase in the number of ingestions from lithium coin batteries in the last year. Lithium coin batteries are those batteries that are in everything around your house, from key fob to your car to remote controls, thermometers, bathroom scales, those sorts of things, about the size of a nickel or so. And it turns out that that size is just right, that if a child swallows it, it gets stuck. It can get stuck in their esophagus or their food tube. If it gets stuck, it will start discharging the electricity that's stored in it, and that can lead to a really significant burn. In the course of even just a couple of hours, that burn can cause lifelong disability or, sadly, sometimes even death.
There's so little, it can happen so fast. So what should we do if we think that our child has actually swallowed one?
Yeah, well, this is why we're so excited about the AAP partnering with Duracell to get this information out to families, because it starts with prevention and preparation. So we want this to be in parents and caregivers' consciousness and be thinking about how they can make sure that kids can't get to those batteries in the first place. So in all of the devices that may house these batteries around your home, make sure that you store them safely so that kids can't access the devices. The devices themselves, we want to make sure that the battery compartment is closed in the way it's supposed to. If it has a screw on it, make sure the screw's tight. If it doesn't have a screw, you may want to think about adding some extra layers of protection, like some tape around it. For the batteries that aren't in devices, store them not in a kitchen drawer, but in a place where a child will never be able to access it. So up, out of the way, out of sight, ideally even in a locked cabinet or container. And then for batteries that are, for the old batteries, make sure that you're disposing of them properly. If they get lost in a couch cushion or under furniture, kids are going to find those things. And even old batteries have enough electricity in them that can cause serious damage.
There's so much for parents to worry about. Anything else that we can do to help keep our children safe?
Well, I think it's, like I said, it's about preparation and about thinking about it and recognizing the hazards that they are. One other thing that's happening with these lithium coin batteries is Duracell has taken it another level and has added a bittering agent to these lithium coin batteries that hopefully will prevent kids from swallowing them if they put them in their mouth. They'll be able to spit them out. It's also important to recognize that these ingestions often come without a lot of symptoms. So it's really important, if a parent has any concern that a child may have swallowed one of these lithium coin batteries, get to the emergency department as soon as possible, because you got to get that battery out of there, and that can only happen with a trained medical professional. Where
can we go for more information?
So the Duracell website at duracell.com, and then the American Academy of Pediatrics website for families, healthychildren.org, has a ton of great information, especially other ways that we can help keep families safe from all the threats around your home.
Well, thank you so much, Dr. Ben Hoffman, for joining us today here on PCTV and helping to keep our families and our children safe.
It's been a pleasure. Thanks for the opportunity. Stay safe.